I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor. What is root cause medicine? I've wanted to talk about this topic for a while, actually, because it comes up as being something that's one of the principles or tenets of naturopathic medicine. And it's often one of the things that gets kind of held over our head or held against us when talking in more conventional spaces. So I wanted to break it down and talk about it. And although it's been sitting on my kind of topic shelf for a while, what really prompted me to do the episode for us this week was a recent news article that was put out by one of the Canadian national news outlets on how naturopathic doctors are not the solution to the primary care crises across the country. And I've done a few social media posts about this article. It caught me on a particularly crusty day, and so I walked through some of their evidence, air quotes, for why they think naturopaths are bad. And I kind of likened it to when you won't name your baby Lucas because you once met a person named Lucas when you were like in elementary school and they were a real jerk. But I do think this conversation about root cause medicine is important because I think both practitioners and patients can be a little misled by the phrase, and it can create some disconnect in the way we feel about how people are being treated. So let's break it down. Now, in my opinion, where some of this has come from, this idea of like root cause medicine and talking about root cause medicine, in my opinion, it's probably come from this, we had a very quick adaptation in medicine to go from talking about very acute infectious disease, where thank goodness we discovered penicillin, but we gave things for things. We gave pills for conditions. Those conditions were relatively serious in the moment, and we gave a thing, and that person then subsequently got better. But as we moved into more of a chronic disease management state with the healthcare system, we didn't adapt quite as quickly. And even still, like if you think about the amount of time spent with your practitioner, you can write a prescription for antibiotics in 7 minutes, but you can't really unravel someone's relationship with food and how that may have set them up for a risk for diabetes in 7 minutes. So as we moved to talking about more chronic disease management and the model didn't really change, it left this kind of gap where people were not having their baseline risk factors addressed by their primary care physician anymore. People were not having their comorbidities concurrently addressed. And so I'm not saying we don't address comorbidities, but it's common that it's kind of a referral game where the person who's managing one aspect of your condition is maybe not also managing the comorbidities. You'd see a different specialist for that. And what we mean by comorbidities is like things that happen together. So you may have a diabetes doctor and a high blood pressure doctor rather than either of them having the time, interest, and capacity to talk to you about both of those things at the same time. So we moved to this model of, still using a lot of like acute care medicine style practice. And yet now the focus was talking about chronic disease instead. And this, of course, would leave patients feeling a bit unsatisfied, right? Patients don't want polypharmacy, we call it, or like multiple medications. Patients don't want to be on a path where things just keep getting worse and worse and medications just keep getting added and added. And in general, patients want to know that they're being part of the process, right? That they're being given these like action items that they can do at home. I think sometimes we paint a picture of very apathetic patients who just keep taking their medication from the doctor that they trust. I actually don't think that's true. I think people want to be empowered to be part of their own healthcare experience and want to be part of the solution. And so all of those desires and the fact that we were maybe doing a poor job of managing some of those comorbidities, and certainly a poor job of managing someone's baseline health, meaning that if you walked in with a reading of high blood pressure, but maybe you had 2 or 3 risk factors that set you up for that, we were never able to address those things, right? We had to just treat what was right in front of us, which was your current high blood pressure today. We really didn't have the resources to talk to people about other aspects of their health, which maybe led them to that diagnosis. And I think that created this opportunity for functional medicine and integrative medicine to come in, with bells ringing, saying, well, actually, we are doing a better job because we are going to tackle the root cause. And I think that's actually great, right? And I'll talk to you about the things I think that are not great about it, but that's actually pretty great, right? That we're acknowledging that sort of factory style medicine, you come in, I'll give you a high blood pressure medication, I'll see you in 6 months, and if your blood pressure is worse, we'll add a little more. That was, A, pretty unfulfilling for the patients, but B, really not slowing down the burden of chronic disease on the healthcare system. And we needed a different approach. So functional medicine, naturopathic medicine, when we talk about root cause medicine, in what that term is often meaning is looking at risk factors, looking at comorbidities, right? And looking at that patient journey. So if the patient's put on high blood pressure medication and no one ever talks to them about salt replacement, our expectation is that their blood pressure just increases over time. And that's what the literature suggests, right? I'm not making this up. If you take a blood pressure medication and nobody talks to you about anything else about your life, the expectation would be is that we would increase the dose next time we saw you. And so this opportunity existed for sort of root cause medicine, and it has a wonderful ring to it. And I do think that it actually had a really impactful impact. Come on, Jordan. It had a real impact on the trajectory of those chronic diseases, especially cardiometabolic disease. Now, enter the problem. There are a lot of chronic diseases or chronic conditions that don't have an quote-unquote cure. And I think when we start talking about root cause medicine, it makes it sound like if we dig deep enough into this pit of your health, we're going to find that one little imbalance or nutritional deficiency, and if we fix said problem, we're going to solve all of your problems. Right? Like we got to find the key that goes in the lock, and we are going to turn that baby, and all of your symptoms are going to be gone magically, and you'll never have to deal with this problem ever again. That's kind of the vision that's erupted about root cause medicine, that if you don't ever get to the bottom of why your blood pressure is high, that you have failed miserably on your health journey. And any doctor who has ever told you otherwise, like maybe that you might need some medication for the rest of your life, is won over by big pharma and is not someone you can trust. And you need to find that one individual who's going to find that really special thing about you as an individual that's going to unlock your health. That's not good root cause medicine. My favorite example for this is honestly acne, and partly because I have struggled with adult acne, and the number of people that keep offering me or pitching me these solutions that I could really get to the bottom of it if I only did X, Y, and Z. That's why this one is such a good example for me. But there are a lot of other conditions that have a relapsing and remitting component to it, right? If we think of a lot of the autoimmune diseases, they have person's diagnosed with an autoimmune disease, we don't reverse it, we manage it, right? And adult acne is another condition that we don't cure, we manage. When we talk about root cause medicine, or practitioners talk about root cause medicine in this negative way, we are often laying some kind of blame on the patient if they can't make their chronic disease vanish. And we also talk down to any other strategy that supports that patient that doesn't lead to cure, which is interesting because none of the solutions that we use for those conditions lead to a cure. And so it creates this push-pull between, standards of care and conventional guidelines for how we treat these conditions, and these magician-like practitioners who think that they just have to find that one special root cause in you, and then suddenly your lupus will go away. And that's incredibly misleading, right? Like we have no evidence that people can make those certain conditions go away. And I know you've probably seen that one person like on TikTok or something that, changed their diet and started eating papaya, and suddenly their Hashimoto's thyroiditis vanished. I can't go to bat against those particular things, but if we were going to speak en masse and at population statistics level, we don't see reversal of certain chronic diseases or chronic conditions. We manage them, okay? So when we speak about root cause medicine in that light, though, we've done a couple of things. One is we've made it sound like a weakness if you use any solutions to manage your chronic condition. I use benzoyl peroxide on my acne daily. It works amazing. It's an amazing chronic management solution for adult acne. I'm sorry if that's making you cringe in your ear pods right now, but I am not rubbing coconut oil on my face or, standing in a headstand to try and get rid of my adult acne. Benzoyl peroxide works amazing. But it is a chronic management solution, which means if I stop for any given length of time, I can have a bit of a breakout. So am I making a mistake because I'm not getting at the root cause of my acne, or am I doing an incredible job of managing it, right? But you can see how if we're gonna position root cause medicine as being this possibility for all conditions, and that what we mean by root cause medicine is that you should be able to cure yourself. What that means is that those management solutions are evil because it's weak, right? If I'm going to use that, that's a weakness, that's a crutch. And we'll hear people talk about the solutions that are being offered for their chronic diseases as bandaids. I don't want to take this thyroid medication, that's just a band-aid. I want to get to the bottom of my Hashimoto's. I don't want to take this steroid for my ulcerative colitis. That's just a band-aid. I want to get to the bottom of my colitis. Those aren't band-aids. They're long-term chronic disease management tools that are preventing bad things from happening. And so when we villainize those kinds of treatments for people and we make people feel weak for using them, they start to question them, and they certainly have difficulty with compliance. We have difficulty with drug compliance at the best of times, let alone if someone watches a TikTok on root cause medicine for their colitis and now suddenly feels like they shouldn't take their medication. So when we talk about root cause medicine in that negative light, meaning that we think we're going to cure your disease if we just find that certain special thing about you, it villainizes the very evidence-based strategies we have for helping you manage it, because it feels like you're just covering up the symptoms, which is really not true. We're putting your body into a state where you're not in a flare. We're putting your body into a state where you don't go to the hospital, or your quality of life is better, or your pain is better, right? All of these things are better when we have good control of chronic disease. But if we assume that these things are band-aids, right, or they're just covering up something, and that you haven't got to the root cause, and if you still have a breakout occasionally, Jordan, you've never really gotten to the root cause of your acne. You know what? If we dug inside my body to the root of my acne, we would probably find a genetic tendency for higher DHT production in my skin, right? DHT being testosterone in my skin. What is the root solution for that, right? If that's the root cause, then what's my solution? So you can see why, if we're going to take that stance on root cause medicine, meaning that we are going to find this special secret sauce that's going to make your chronic disease evaporate, you can see why conventional medicine would find that to be pseudoscience, or why they would poo-poo practitioners who made those kinds of claims, or who led patients to believe that there was a way for them to reverse their chronic disease. I would also have a very difficult time working with those practitioners, and I do, right? If I come across those kinds of practitioners in my work, it's very difficult for me, because I think we've taken this goal and desire for health and wellness to be incorporated as part of the conventional medical model, and we've bastardized it by making it sound like it's the only way, or it's a way that's more permanent, or more, it's better than doing anything that conventional medicine has to offer. And that's absolutely just not true. And yet, right? And yet, talking about getting to the root of some of your challenges, or getting to the root of your lifestyle that has set you up maybe for some of these chronic diseases, or the root of some of the behaviors or nutrition or deficiencies that have made you at risk for other conditions, or who have put you on a path towards having more and more medication all the time, or having worse and worse outcomes with your chronic disease, I think it's quite admirable that we would like to get to the bottom of that, right? I think it's actually quite desirable for us to want to treat the root cause of your hypertension. But that doesn't mean that you're going to put down your medication in favor of those things, because for some of you, that's not possible, right? For some of you, the reason you have high blood pressure is not something that we can fix with nutrition. And so we can have both of those things at the same time. We can have this deep desire for us to be agents of change in our medical journey. We can have this deep desire to do everything we can to have a better life and better health, and to try and change our own trajectory towards more and more medication. That is incredibly desirable. And I think we all deeply want that. We just need a bit of direction around what that actually looks like and means. But the relentless pursuit of undoing your chronic disease as being the top shelf goal for how we look at you and how we support you it's a journey that has no end, right? That is like trying to solve a puzzle that we may never solve. And when we make that the North Star, right, trying to get to the root cause of your condition, which maybe your condition was like triggered by an infection, and now you have another condition later that's a consequence of that, like the root cause might be gone. The root cause might be your genetics, in which case there is not a solution for that, right? And so when we hold that as our North Star, that we're going to try and relentlessly pursue the solution that reverses something that's irreversible, you can see why we get a little off track, or why integrative medicine can be seen in such a bad light. So what I want you to take away from this episode with, and what I want to equip you with, is one, there are some conditions that the root cause cannot be treated. And what would be really helpful for you is for you to have a great discussion with an evidence-based practitioner about what is your condition, right? Like education, it makes such a difference for patients to understand where they came from, like what were their risk factors, where are they now, right? And then where are they going? So if nothing is done, what happens in the future? That's incredibly important information for you to have. But one question you can ask your clinician is this reversible, right? Is this something that can be undone? Because for many chronic conditions that we are discussing, they can't be undone, right? Or they are not reversible. What we can do is manage them beautifully, right? But your tendency for that condition might still always be there. The genetics that predispose you to that condition may always be there. Some damage from your condition may always be there, and that's okay, right? That doesn't mean that you have failed, that you can't find the root cause. It means we want to switch our relationship with your condition to be about management and not cure. And that is not a failure, actually, right? That means we want to develop, and I always use the word relationship because when working with people with a chronic disease, you develop a relationship with your condition. You learn about it. You learn about the things that make it better or worse, or that trigger you, or that set you back, right? We learn about these things. You have a relationship with your condition. Even though I don't want to admit it, I have a relationship with my acne. And so it's not a failure to learn to manage your condition and stop seeking the root cause. So ask your doctor, right? Is this something that is reversible? Don't ask TikTok, right? TikTok thinks everything is reversible. Ask your doctor or someone that you trust on your medical team. Is it possible to reverse my condition? And if that's the case, then let's point that North Star towards root cause and try and undo it as much as possible. But if it's not, then what we want to know is what factors that are related to your condition that you have control over. And some of them you don't, and some of them you do. And when we talk about root cause medicine, figuring out which parts of your condition are within your control to impact and then strategically impacting them, that's root cause medicine. Figuring out which parts of your health set up the condition, meaning that put you at risk. Can we undo that? Can we change that trajectory? Let's figure out the parts of your health that are worsening your current state, and can we undo some of that, or can we change some of that? And let's figure out which levers we have to pull in order for you to be on a slightly different path than if we left you unhelped, right? If we just left you in the wild with high blood pressure, it would just go up and up over time. But what are the levers that we can pull in your day and your health and your mindset and the way that you approach your mental health to actually be able to help you co-manage your own conditions so that you can not just get put on polypharmacy and have your medication go up and up and up over time. That's root cause medicine, right? That's supporting the root cause as much as humanly possible. I'll see you next week.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.